sneeze. I go when I head, use your elbow when you cough. I go when I head, use your elbow when you cough. Hey, hey, Nina, hey, use your elbow when you cough. Hey, hey, Nina, hey, use your elbow when you cough. When you're in a taxi and when your cough won't stop, see your doctor now, see your doctor now. So when you got that cough and people are around, what you gonna do? What you gonna do? I go when I head, use your elbow when you cough. I go when I head, use your elbow when you cough. Hey, hey, Nina, hey, use your elbow when you cough. Hey, hey, Nina, hey, use your elbow when you cough.
Use your elbow indeed when you cough. All right, we're talking colds and flus. You've just joined us. And with me in our Johannesburg studio, we have Dr. Murumisi Mukansi, pulmonologist based at Helen Joseph Hospital. And next to him is Prof. Cheryl Cohen, Center Head for Center for Respiratory Diseases and Meningitis from the NICD. And it's a pleasure to welcome from our Cape Town studio, Nicole Jennings. Nicole is spokesperson for Pharma Dynamics. Welcome to Health Talk, Nicole.
Thank you very much. It's a pleasure to be here.
All right. Nicole, we're talking prevention of colds, flus, and pneumonia. And I think it's relevant for me to ask you about the survey that you recently did, where you obviously, put a few questions, to South Africans around what they're planning to do for this flu season. Do you perhaps just want to share perhaps the highlights of your survey with us?
Yes, certainly. So we conduct the survey on an annual basis, and we had about 1,500 respondents. And we saw that 40% of South Africans actually said that they plan on exploiting the colds and flu season by taking a sickie day. So that's the one side of the spectrum. Then we also saw that 17% of South Africans actually say that their employers put pressure on them, or they feel pressured to go into the office even when they have a cold or a flu. And 11% of South Africans said that they actually fear that they might lose their jobs if they take sick leave. So we see a massive imbalance, in the situation in the country. And I do think, people that exploit the system, that take sick leave when they're not actually suffering from a cold or a flu, are worsening the problem. And they are, leading to employers sort of putting pressure on employees to go into the office when they are actually under the weather and feeling sick.
It's worrying that, people are planning to take sick leave days and that sort of thing. We're going to come back to you just now, Nicole, but let's take Lee on the line from Devon. Lee, welcome to Health Talk.
Hi, thank you for taking my call. Okay, I would like to know if inhaling very strong perfume or something like paint can cause symptoms of cold or flu. Because I've had problems in the past that just by smelling paint, I get sore throat or blocked nose, and then I get very weak.
All right.
Is it related?
Good question. Thank you very much for your question, Lee. Let me perhaps put it to Prof.
Yes, another very good question. And I think the example you've given, in fact, of something like the smell of strong paint is a very good example of what we were talking about, where the feelings that you have, like a sore throat or a blocked nose, can be because of an infection, but many other things can cause them because it's really your body's reaction to something uncomfortable. So you're absolutely right, especially paint, that can be quite toxic, in fact, the fumes, and if you breathe them in, they can cause the similar symptoms. So a sore nose, a sore throat, etc. But it's not cold and flu at all. It's not an infection. It's your body's reaction to a toxin or something that's hurting your body because it's a chemical.
Yeah.
And so that's important to know. So the treatment or the management is different. You have to get away from it, and try and do other things to improve your situation. But it's not the same as you would manage an infection.
Whilst they're talking about causes, before the break in the last segment, I mentioned this issue around the weather and, cold weather being a causative factor for colds, flus. Your comment?
So I think people often say that cold weather causes colds and flu, and I think the reason why people sometimes think this is because often this is the time of the year now, as we go into the winter, that we see colds and flus going up. And in fact, the reason why colds and flu go up in the winter is because they're caused by viruses mostly, and viruses are spread between people. And when people are in close contact, the viruses spread more easily. And we know that in winter, people are much more likely to huddle together in the houses. You have all the windows closed, there's less ventilation, and that facilitates the spread. In addition, there are quite a few studies that show that viruses like the flu virus actually survive better on surfaces or in the environment when it's cold compared to when it's warm. So there are reasons why in winter there's more colds and flu, but that's not the same as saying the cold causes the flu. The viruses are the cause of the infection, but the infections go up when it's cold because our behavior changes when it's cold, and that allows the infection to spread much more easily between people.
All right, okay. Let's get back to Cape Town and speak to you again, Nicole. Now, you obviously are from Pharma Dynamics, representing the farmer. Oftentimes you hear people, and this relates to the immune system and nutrition. People generally go to pharmacies to try and get some immune boosters and some vitamins and whatever else that gets promoted out there. From your perspective, what advice do you normally give in terms of what people can take in the hope that they're preventing colds and flus?
Okay, so in the first place, I think I just want to highlight that a new body is actually recently taken over from the current regulator, the MCC, called SAHPRA. So that's the South African Health Products Regulatory Authority. And SAHPRA going forward will now be responsible for the regulation of vitamins and supplements as well, a form of medication that previously hasn't really been very regulated in the country. So I think that's good news for patients in general because, they'll now be able to have more confidence in picking up an immune booster or a vitamin off the shelf when they visit pharmacies. Then there's a very wide variety of products available out there. The first thing to do is to draw a clear distinction between an immune booster and an energy supplement. So immune boosters will generally contain ingredients like your vitamin C, often zinc and echinacea, and ingredients that are linked to, optimal immune functionality. Whereas your energy supplements usually contain the vitamin Bs and other types of ingredients. We always advise that you speak to a healthcare provider, whether it's your doctor or your pharmacist, just to make sure that you're not exceeding the maximum daily dose of any of the ingredients. And also, if you are on other chronic medication, like heart medication, for example, just to make sure that there aren't any drug interactions that take place when you, self-medicate during the cold and flu season.
All right. I have to get a comment from you two. Perhaps let's start with you, Dr. Mukantsi. What's your comment around the whole notion of, taking vitamins, supplements, and immune boosters as a way of prevention?
I think obviously I have to integrate science with what commonly happens to say to say that there may be shortening of the flu episodes, perhaps on those that take vitamin C, and in whichever way they take it. And one of the recent studies has shown that vitamin D may help with these type of things. And sometimes the zinc lozenges as well, apparently they have a role. So it's really to stay healthy, hydrate yourself, and make sure what she has just said, Nicole, is that you maintain a balance of not over supplementing yourself and under supplementing. So there is a role for some of these things.
Prof, do you want to comment?
Yes, I mean, I would agree. I think for some of these immune boosters, there is some evidence. For many others, really, there's not really been studies to show that if you take X product, it's really going to reduce your risk of flu. And a lot of it is driven, I think, also by financial motives. And people want something that's going to protect them. If anyone could build a vaccine that would get rid of all colds and flu, they'd be a multi-millionaire because
talk about a vaccine. Let's stay there because, at least in the last few minutes, we're talking prevention of the most important thing in terms of influenza. is the vaccine. Just take us through how, for instance, that is determined, because we're told that there's a different vaccine every year.
Yeah, so absolutely. I mean, I think we should distinguish between non-specific things like immune boosters versus a vaccine which is really designed to target a specific infection, which is the flu. As you've mentioned, the flu vaccine is updated every year, and it's one of those vaccines you have to have every year, which means you have to remember to go out and get it each year. The reason for that is because flu is a virus that changes very rapidly. So every year we know in the winter we're going to get flu, and it's going to come and cause a season like it's causing now. But we know it will be slightly different from the flu last year. And that's because the virus is constantly changing to evade our immune system, our body's defenses, because it wants to keep on infecting people. And so we monitor at our institute the flu virus for South Africa, and every year we use the information from this year really to decide what to put in the vaccine for next year. And so it's quite a unique vaccine, in fact, because we monitor it and we update it every year. But it's important because flu vaccine really directly protects against flu, so it is likely to be more effective, for example, against influenza. It can't protect against other things compared to your immune boosters, etc.
Dr. Mukansi, in the last 20 seconds, we're out of time in the segment, but I think it's important. I want us to link to, that short clip that we played. Obviously, we're not just talking about prevention of being infected, but we're talking about preventing the spread. Your few words on that?
That's why the entity of people being absent from work worries me, because there are those who should not mix with others when they have it. So one way is the way you cough. You should try and close the mouth and the nostrils at least, and then try and not share utensils with other people, because the virus is passed on that way. So whether it's toothbrush, it's other drinking things and plates and stuff during that time.
Yeah, I think this is quite important, and we shouldn't rush it. Perhaps we'll just take it further in the next segment. Okay, time for a quick break. When you come back, we'll now talk about how we manage these conditions. Please stay with us.
From the Cheetahs, brilliant score.
Imran Tahir produced a superb performance with the ball. The Proteas leg spinner put his side in the driving seat, scalping 3 wickets for just 18 runs.
Gifton Gope is flying toward third, and he is there with a triple, his first in the big leagues.
It is a Ferrari front row lockout, unless Hamilton can get on pole, and he can't. Ferrari, for the first time since France in 2008, have locked out the front row.
For all your sports news, keep it locked to Sports Live every Saturday and Sunday from 20:30.
Rights and recourse tackles constitutional issues.
When South Africa became a constitutional democracy, we had a fairly sound legal system in place requiring the Constitution to guide the direction in which it must go and the way in which it must be refashioned.
The Justice Ministry, the custodian of human rights.
We actually have a plan to come up with a comprehensive review of our human rights instrument.
Advocates dealing with evidence.
Sometimes you have to use a crook to catch a crook. So we expected that credibility would really be taken to task. You try and consult your witnesses and prepare them as best as you can.
Hashtag Rights with Dumila Mates on legal issues every Sunday at 2 o'clock Central African time.
Welcome back. We're talking colds, flus, and pneumonia with my 3 guests. The ones in Joburg, Dr. Murumisi Mukansi, a pulmonologist at Helen Joseph Hospital, Prof. Cheryl Cohen, Center Head, Center for Respiratory Disease and Meningitis at the NICD, And in our Cape Town studio, Nicole Jennings, spokesperson for Pharma Dynamics. All right, let's start in Joburg. And before we start our discussion, let's take a caller, Andiswa from the Eastern Cape. Andiswa, welcome to Health Talk. Andiswa, are you there? Andiswa is not there. Okay, we'll try and get back to. Okay, now we're talking about management of colds, flus, and pneumonia. Perhaps let's start with you, Dr. Mukansi. Just the principles of management. So somebody experiences these symptoms. At what point should anybody feel that this is the time to go and consult a healthcare professional?
I think, just like everything else, if it's mild and when you use supportive things like painkillers and decongestants and that, and it goes away, it's always not a problem. But if it carries on and this thing, it gives you more and more distress, you better see a practitioner, because there may be consequences to any illness, no matter how mild we talk about them and we classify them. That's usually what we do in a discussion, but in real life it can lead to anything. Like I said, in the common cold, influenza, they can complicate with pneumonia and maybe neurological complications, Guillain-Barré type of things. Yeah. So you can have these things complicating, which means if ever it takes longer, it takes about a week, it should take to clear. But it means during that time you're getting better, not that you're sitting and hoping that things will get better while you're not. Yeah. And then hydrate yourself, obviously, and seek care. And remember that the virus doesn't need an antibiotic. Yeah. So we give an antibiotic.
Well, we're going to come back to that, because that's a big issue. Yeah. Okay, but what are those? Are there like flag symptoms, that will say to you, here I need to go and see a doctor?
I think if it starts getting worse, whatever we said, like common flu, common cold, will be mild, this thing, runny nose and stuffiness, and maybe a sore throat. Right. And if it gets worse and you start getting muscle aches and you start getting production of the cough, and it starts giving you chest pain and those type of things, it really tells you it's on a road not to getting better, but to worsening and giving you other things that may be worrying. Okay. And sometimes
before we get to the doctor, then, you mentioned people try certain things at home.
Yeah.
There's all sorts of stories around. Grannies pass on this wisdom from generation to generation in terms of what people can do at home. Mm-hmm. You often hear stories. In fact, let's go back to Michelle. Michelle mentioned something about boiling whiskey, I don't know, mixing it with what. But she's not the only one. There are many other people that believe that you boil brandy with whatever else, ginger, and your comment on these home remedies.
I think if it makes you feel better, that's fine. There's definitely no harm with most of them. Yeah. The problem is, if I say, is there scientific evidence for me to advise that, then I would be going behind my realm. Yeah. But something that I can say they are getting from most of the remedies we're talking about is they are getting well hydrated, which is something that's quite very important. And perhaps whiskey will make them sleep better.
Oh, well, okay. I thought you were becoming an ethical doctor, but there you go again. All right, let's cross to Cape Town and speak to Nicole. Nicole, your comment in terms of, what people can do. You mentioned that sometimes they do go and, visit a pharmacist. In terms of, the normal, or your advice in terms of what people can do when they start experiencing these symptoms.
Okay. First of all, obviously, first prize is to keep your immune system strong. So there's a big focus there on nutrition to make sure that you're eating, well-balanced meals, getting all your vitamins. And then, of course, also exercising regularly if that's possible for you. If you do feel like your lifestyle is very demanding and you're not able to, always follow a healthy, nutritious diet and that sort of thing, then you can consider taking an immune booster to just assist your immune system as well. Then I also just, want to do a call on patients to not go into the office when they are suffering from a cold or flu. Often, the areas aren't very ventilated, so it's very easy for the virus to spread. And then a last call, we recently actually had a symposium where we focused on antibiotic stewardship. And we found that a lot of general practitioners experience pressure from patients to prescribe an antibiotic when they suffer from a cold or flu. So, just to call on patients not to put pressure on their general practitioner to prescribe an antibiotic, to leave it up to their discretion to decide whether it's a viral or bacterial infection. Because, antibiotic resistance is a real threat, and it is something that we need to focus on and we need to address.
But what about pharmacists, though? Because oftentimes you hear pharmacists dishing out these antibiotics, sometimes even without a script.
Yes, which again, I think everyone must take responsibility there. So from the patient's side, not to put pressure on their general practitioner to prescribe the antibiotic. Pharmacists should not be dishing out antibiotics without a script, and patients should definitely not go to pharmacists and ask them for antibiotics. Similarly, if one person in the family is using antibiotics, they don't finish their course and they share with the rest of the family. All of these elements contribute to antibiotic resistance. So really trust your healthcare provider, trust in their opinion on whether you need an antibiotic, and then do use your medication as prescribed.
Okay. Prof, I know that there's lots of professionals that watch this show, so lots of family practitioners or general practitioners watching this show. Your advice to them now in terms of the criteria for prescribing antibiotics and how to deal with patients that put pressure on them.
So I think it's a real issue, and I think you have two groups of patients. You have the patients who put pressure on doctors to prescribe antibiotics, and you also have patients who really strongly resist antibiotics and don't want antibiotics, sometimes for their children, for example, even when it might be indicated. So I think general practitioners are in a difficult situation, in fact, trying to navigate the fact that these days the public is very educated, they have access to information on the internet, and they come in with their own preconceptions. And I think, so there are certain signs and symptoms that doctors would look for that would suggest a bacterial infection more than a viral. Fever may be more common in bacterial infections, although you can get it with a virus. And also often on examination, the doctor might see signs of inflammation in the ears, in the throat, that also would be more suggestive and help them to make the decision of whether it's a bacterial infection. And I think what's really important is that the vast majority of colds and flu really don't need antibiotics. And in fact, antibiotics can be harmful, and they can have side effects, especially in children. Antibiotics often have gastrointestinal side effects. They cause diarrhea, they cause other rashes and other problems. So, however, when they're indicated, in other words, when there are signs of a bacterial infection, or when the doctor is concerned that it might be progressing to pneumonia, so maybe there's signs when they listen to the chest, they hear that there's an infection in the chest of a child, for example. Those are the situations where really it's needed, and if you don't get an antibiotic, it's going to potentially result in worse consequences. And I think doctors really need to try and communicate with their patients about the benefits and the risks, and share with them the knowledge and the evidence that they're using to make those decisions, so that the patients come along with them.
In one of the earlier clips we played, somebody mentioned, I can't finish the course. How important is it?
So the course or the number of days that we give antibiotics for is done for a reason. It's really based on studies that have been done to show how long does it take for these antibiotics to get rid of the bacteria. And if you don't finish the course, what can happen is that you have these bacteria that they've seen this antibiotic and they've developed a way of resisting it, but you haven't got rid of them. So not finishing the course is a bad thing, and it can lead to recurrence with the infection that's more difficult to treat.
Before we wrap up, we have some 3 tweets that I'd like to just quickly go over. If you could just get them up on the screen as soon as possible, and we up and going. And the first one says, after 2 weeks of being sick with flu, I had 2 days of relief, and now it looks like it's about to start again. TF. MZB says, I don't want to take flu medication because I know the flu will just finish its course regardless. Immune boosters, maybe. And Wonderland Guru says, flu vaccine, is it worth it? Okay, that was the last tweet. And perhaps just give you 10 seconds each to just wrap up your final message, Dr. Mukansi.
Okay. I think we should obviously take these 2 diseases seriously, the influenza and the pneumonia, and try and prevent them by especially the vaccines of influenza and pneumonia vaccine as well. We have a pneumovac vaccine, and when we're not well, we should see our healthcare providers to help us.
Yeah, okay. Unfortunately, we're not going to have enough time to go through to Firstly, let me thank you, Nicole Jennings, spokesperson for Pharma Dynamics. Thank you so much for your contribution and very interesting study, by the way. And of course, in our Johannesburg studio, Professor Cohen, Center Head, Center for Respiratory Disease and Meningitis at the NICD. Thank you so much for your time. And of course, as always, Dr. Mukansi, pulmonologist at Helen Joseph Hospital. Thank you for your contribution. Okay, folks, that's all, unfortunately, we had for you today. Join us again next week, same time on SABC. And please keep on sending us those comments on our Facebook page. And yeah, thank you so much for your calls. Thank you for your tweets. And please do take care. Bye-bye. Thank you.